Hello, everybody, and welcome to the new episode for Socialism and Strawberries. And today we have got a brilliant guest who's going to be speaking about the Carers Organised campaign and where they are up to nowadays. So I'm going to pass over to Ali. Ali, how are you this week?
I'm very well. We've had a really busy couple of weeks at Care and Support Workers Organise, but we've had a little bit of a rest and kind of catching up with ourselves. But no, I'm really great and I'm really pleased to be on the show. So thanks.
A lot. And how long have you been a carer? Can you tell us a little bit about your experiences working in the care sector, please?
Yeah, so I've been working in social care for about 15 years. I've worked in many hats in kind of many different organisations, mainly in the third sector, actually. So I started care in about 2005-ish. I've worked in care homes. I've worked in wellbeing centres, and at the moment I'm a senior practitioner in a 24-hour supported accommodation. So I work with people experiencing mental distress, but I've also worked with kind of other disabled people in the community offering support too.
So in terms of like the campaigns that have come up during the pandemic, could you tell us a little bit about what's been going on?
Yeah, so the pandemic has obviously been really, really difficult for care workers. You know, we are understaffed and overworked, and it's been a terrifying time for everyone, really. But there's been some amazing shows of strength. So I think it'd be kind of just if I didn't start with the SAGE workers at United Voices of the World. Amazing group of workers who have come together and, you know, were facing some really tough times with their management during the pandemic, but came out in what can only be described as a historic strike action, you know, calling for what care workers have known that we've deserved for a long time. So it was time for 12. They were calling for £12 an hour. They were calling for parity of steam with, you know, our NHS colleagues. They were calling for, you know, fair annual leave and sick pay, decent PPE to be kept safe in our workplace. And so they went on strike. I think they were out for, I think up to 8 days. Sorry, I can't remember exactly the amount of days, but that kind of acted as a bit of a catalyst to care workers across the country, because, you know, it's nobody in kind of care or social care wants to take strike action. It is your last resort. And seeing these care workers, you know, kind of taking action when we know that we are on that line now, we know that services can't get worse. We know that the government didn't look after us during the pandemic, and seeing those workers was so inspiring, and seeing their bond, but also how much, you know, they cared for the people that they support, because, you know, health and safety is a public health concern, and so they were concerned for the people that they support too. So yeah, they acted as a bit of a catalyst to care workers standing up and, you know, kind of showing us that we have the right to be angry, and we, you know, we need to take this opportunity and organise. So so I am a co-secretary of Care and Support Workers Organise, CASWO, and we kind of formulated on the back of a unison call. So there was a unison call which was mainly addressing our concerns around PPE, the fact that we had inadequate PPE, the fact that there were people on the call fashioning their own PPE, the fact that a lot of people in social care are not used to, you know, wearing PPE. How do you don PPE effectively? How many times you should change a mask per shift, etc. So there were all these concerns kind of flying around with carers on this unison call. And so we kind of got together, and once we started getting speaking, we realised that these issues, we had the same issues. And there were workers from United Voices of the World, all on that call, and we had more in common that separated us. And we were from the third sector, some public sector workers, some working in private care homes, domiciliary care workers, personal assistants, but we had a common thread. And that's that we've been screwed over for a long time, and there is a lot of anger, and there was an understanding that these issues were there before the pandemic, and they will be there after the pandemic. And we need to get together and have a common narrative, some common demands, some political demands to push both our industrial work forward, but also to raise awareness, because we have been invisible for far too long. And that was a kind of another common thread of just, giving each other a platform and hearing each other on those calls was really, really empowering. And so CASWO came off the back of that. And we've been busy since and during the pandemic, really, because unfortunately, to say out loud, the pandemic, although we were clapped, and although there is a higher consciousness around our work and what we do and just how essential we are, actually things have got worse for us during the pandemic. And that's for quite a few reasons, which I can touch on a bit later. But I want to concentrate kind of firstly on the fact that we have come together, and now we're a national group. So we have members in the Northeast, in London, in Suffolk, in Brighton, in Oxford. So we're beginning to come together to, begin to organise, and what that looks like, and kind of forming an organisation is difficult. So we've been busy, basically.
Yeah, so in terms, you've brought up issues that carers have had. So what would you say were the issues that you were prioritising currently?
Okay, so as CASWO, we have kind of 8 demands, but the things that we are prioritising, but things keep getting thrown up for us. So on the 19th of March, there was a decision by the Supreme Court which ruled that we are the only workers that are not entitled to minimum wage whilst at work. So during the sleep shifts, we're going to see a return to kind of subsidies. Some people get paid as little as £35 to be on shift at work, being a listening ear for disabled people, being there to respond for a crisis, but away from their families, but not deserving the minimum wage. So, that was a real kick for care workers. We have been waiting for that decision since, I think that case has been going on since 2016. And it's apt almost that during a period when we've never been so needed, still our labour is considered so worthless that we are not considered to deserve a minimum wage. And bearing in mind, we'll be disciplined if we leave those projects. Now, this is very unique to the UK. This isn't, not all care workers around Europe are treated this way. This is kind of a unique position. And so that was gutting. It was also the same week that Sarah Everard was murdered. So, to be a working class woman, and the majority of us are working class women, 80% of care workers are women, realizing that, we're invisible and that the state isn't there to kind of look after us, and nor are the courts. And so it was a really, really difficult kind of emotional week for quite a few of us. So that's kind of one instance of, how things have got worse for us. But also, I think that we should talk about mandatory vaccinations. And actually, it's quite fitting. So today is the last day, on the 16th of September is the last day that if you have not had your first vaccination, you will be dismissed, and with no remuneration for that. Now, I would like to say that, CASWO and myself personally are very pro-vaccination. We've done creative things as trade unionists to encourage the uptake of vaccines and to challenge vaccine hesitancy within our workplaces. However, this is a very blunt tool, and bearing in mind there's already 112,000 vacancies within the sector. In London, it's 9.5% vacancy rate. This is dangerously low. Some essential services are going to struggle to, deliver safe services. And on top of this, where a lot of workers in the sector are picking up those extra hours, who are doing longer shifts, who are doing favours to managers because, we don't want to see our services unsafe. We owe that to our colleagues. So we're picking up all these extra shifts, but now a lot of experience from the sector is going to be lost. So I spoke to one woman who still had concerns around the vaccine due to fertility issues. I've offered her kind of all the information, the new information, but at the start of the pandemic, that was an issue, and mud sticks. And so there is still a lack of education and unmet concerns. But she'd been working in the care sector for 7 years of experience and support and reacting to crisis and care, and that's going to be lost. And so I grieve for the experience that are going to leave the room over the coming weeks. So it's been a bit of a slap again for us, because I think also a lot of care workers feel bullied by this decision. Where is the support? It feels a lot of stick and no carrot. Where was our sick leave? Where was mandatory, full sick pay for all? That took months of, fighting for with the Infection Control Fund, where we know that didn't filter down to frontline workers. Where is our guaranteed PPE? So there's been where is the paid time off to get the vaccine? Where is the assurance that if you have side effects from the vaccine, that you're not going to struggle to pay your bills? None of that was present, but mandatory vaccinations have come in and people feel bullied and intimidated by it. And as a reaction to that, they've, kind of turned away and said, you know what, I'm not doing this for minimum wage anymore. I'd rather work in Amazon. And that's where we're at. That care workers are leaving to go to Amazon because it's been such a rubbish 18 months for us.
That's absolutely really disappointed that carers are, leaving the sector. I guess for me, there's always been an issue with the wages, hasn't there? Do you know what I mean? They've never ever been valued as an industry, to be honest, carers. And what are your hopes with what you're doing with Care Supporters Organised?
Yeah, so I absolutely hear you about the concerns of, the majority of us, 2/3 of us, are on minimum wage. And this is, for probably because of historical reasons, that this is considered women's work and this isn't valuable work, or this doesn't, add to, production, and we're not, but this is vital work, and this is complex work, and this is draining work and emotional work. And so at Care and Support Workers Organised, we're fighting for 15. We think that the true value of our labour has never been recognised, and we deserve an average wage. £15 an hour is an average wage, and we do exceptional work. So we are unapologetic when we say we deserve £15 an hour, because it is hard work. And, I work with some courageous people who are struggling to pay their bills, and it's got to stop. So we are, unapologetically saying we deserve £15 an hour. And, we are being supported. We're not, this isn't rogue. This isn't, this isn't blue sky thinking. GMB. One of the biggest unions in the sector have come out and said, absolutely £15 an hour. So we'd absolutely support that demand. I believe that was passed at the TUC conference just a couple of days ago, along with a lot of great kind of contributions from Unison too. So we're saying fight for 15. That's what we deserve. And the public are on our side. So a recent TUC report said that 83% of the general public support the fact that care workers should get at least £10 an hour. So people recognise our worth. The only people who don't seem to do that is our government. So, we'll shout for what we think we deserve, which is £15 an hour.
And Ali, what would you say about unpaid carers? So in my borough of Wandsworth, we've currently got 19,000 unpaid carers. So would there be an opportunity for them to get involved in the campaign, or is your campaign geared towards carers and support workers?
I would say we stand in absolute solidarity with unpaid carers. Many of us are. You know, especially during the pandemic, we have elderly parents, we have neighbours, you know, we have kids. And so, you know, we stand in absolute solidarity. And also we want to work with unpaid carers because we know the heart of the problem with social care is the structure of social care. And that's not just the way it's funded. That's not the way it's paid. It's about power. It's about who has the power to create, design and deliver services. And disabled people, people with chronic illnesses, those in receipt of support and unpaid carers are often cut out of that. And when we design a new system of supported services, unpaid carers have to be at the heart of that. And so absolutely we want to hear more from unpaid carers and what we should be arguing for on that demand. However, CASWO is mainly for paid